There we go. So glad everyone can join us today for Special Education Thursday. This is our every other Thursday webinar and phone call on a topic in regards to special education with some very Washington, D.C. kind of specific areas. My name is Molly Whalen, and I'm with AJE, which is Advocates for Justice in Education, and we are the Washington, D.C. Parent Training and Information Center, and we support parents in Washington, D.C. in navigating special education and understanding disability advocacy and how they can support their children. I'm really happy to be joined today by a speech therapist who works in our D.C. public schools, and her name is Deanna, and she will be telling us about speech therapy, and we'll have a little conversation. And as I said, it's recorded. If somebody wants to send questions, you can use the online link to be able to chat and send me a question, or also open it up. And I will ask everybody but the speaker to put their phones on mute, just so that we don't have any background noise or something else that's going on. So as I said, we are trying to make this series really parent-centric, and we're going to get really basic sometimes, but also hopefully answer questions that maybe everything that a parent who has a child with special needs may want to know. So thank you so much for Deanna, and I would love it if you kind of introduce yourself and get background in and what you do.
All right, so I am Deanna Camp. Right now I'm currently working in Washington, D.C. public schools, like you said, as a speech and language pathologist. My background is mostly with children with autism or children with severe language deficits. I have a master's in speech and language or communicative disorders. And then I just received my doctorate in special education with an emphasis on autism and developmental disabilities. So that just means that I just went back to school to get a little bit more education, to be able to inform, educate the parents that I work with about children that come to me with autism, because at the end of the day, yes, I provide the services, but I want the parents to be able to take what I told them and work with their child at home, because I'm doing 30, maybe 60 minutes a week. And if the parent works with them as well, then the child is getting double that time. So I think that's pretty much it as far as my background. I'm providing services in a public school in D.C., and I'm here full time.
Terrific. And I should probably address you as Dr. Camp, so I apologize. We got very familiar.
No, it's fine. It's Deanna. It's fine.
Deanna and I have been working on a couple of parent advocacy and parent involvement projects at her school, so I was so excited to tap her with this. And, before I get into some of the questions that I had and maybe some parents, I thought you made a really neat point about, I think sometimes with parents, when they start having a student in a school and have therapy, they may say, hey, I'm sending my child to school to, have the therapy and to have this, and it's here you go, Dr. Camp, it's all in there. But could you really speak a little more to the ways a parent could really work with you and communicate with you and be involved and understand the importance of at-home therapy, or at home doing some of the things, reinforcements, I guess, for lack of a better term?
Right. So, and I'm glad you said that, because I do get a lot of parents that have concerns, and it could be speech. And not to have too much jargon, but speech is just like your articulation. Like, they can't say the P sound or the B sound, which, we follow like a milestone, a developmental chart. Or if they have a language deficit, can they hear me? Are they following directions? It's like when I tell them to do something, they're not listening. What's going on? They can't sound out this type of word. They can't comprehend when they're reading, answer main ideas. So typically we try to figure out what's the deficit area first. And of course we do an assessment. And from there, I try to come up with a plan. But when it's reinforced at home, I can tell. And sometimes the kids will come back and say, oh, Mommy worked with me with this. We had a mirror and we did this. So, again, I'm doing 30 minutes or maybe 60 minutes a week. But when the parents can do maybe 5, 10 minutes, I try not to bombard them because then the kid can sometimes develop anxiety. So I just say, go home, make it fun, practice it. It doubles the amount of intervention. And so, of course, when you get more help, the progress or the prognosis is a little bit more positive. There may be a more positive outcome when you can tell that they're doing the work at home.
Yeah. Yeah. And I think that's really neat that you said that, because as everybody who's joined these calls before or who knows me in the city, I have 2 children with autism, and they're 15 and 16 and have had speech therapy almost their whole lives. And one of the things that I really had to say early on to some of the speech therapists I was working with is I have to be a mom, and I have a full-time job, and I have all these other things. And I want to support my kids, but I can't be a fist too. But give me, and I used to say, give me one thing this week that I can work on, or one, a bite-sized piece. Maybe it's when you take your child to the grocery store and, out, show me all the things that, have a color red, or, and I think it's great when speech therapists like yourself kind of give those, it doesn't have to be a sit-down homework assignment, but it could be making dinner while you're doing chores, while you're on the metro, the pieces like that, right?
Exactly. A lot of times I tell my parents, when you're driving a car, especially or specifically with the little ones, you could drive in a car, looking out at the environment. Oh, look at that big green tree. So you just introduce an adjective, you just introduce the color, and then you just introduce a vocabulary word, which could be tree. And then you just expand on it. So the more and more you're just using just your natural environment, you could be building language-based, you could be targeting their language needs. If they're having like difficulties again with the P sound, you could just be walking around trying to find everything that starts with the P. Or again, in the bathtub, sometimes parents are, monitoring their kids are taking a bath. In most cases, some parents have like a mirror up, and you're like just blowing bubbles, or you say with a B, and just go blow and just go buh, buh, and just keep playing like it's like a game. And so a lot of times that's what we try to do, is just make it really quick, make it real easy, make it fun, and make it natural. And sometimes that's all we need. And then they come back to me, and then I'm like, oh, I can see that you've been working. So it can be really easy.
And it seems like in schools, I've never really scientifically studied this, but is speech therapy kind of one of the most common services or special education services a student in a school would receive?
Yes. Typically, we have the largest caseloads. A lot of times, and that's why I like to, again, inform the parents, because they could be concerned when a kid is like 2 or 3, and they are not saying like the S sound or the T sound. And we're like, well, they're very young, and according to this chart, they don't need to really be saying that sound until they're like 6, for example. So sometimes we try to catch them before it turns into, oh, here's another kid that needs to be assessed. But yes, we typically have the largest caseload because communication is really important. At the end of the day, if the child can't say hi or bye or I love you, parents are concerned. So that's one of the most important things that I've heard from parents. Like, oh, they're not saying this. They're not identifying their colors, or their brother is doing this, but he's not doing this or saying this. And so it causes a lot of alarm, and I have to show them like little, pieces of articles or charts to say, but it's okay. Just give them some time. And if it's not there by this time, then yes, we need to jump in and provide a service.
So I'm going to, I should know all of this by heart, but I have to admit I kind of float around with these terms. But, I think sometimes you also think speech therapy, my child's speaking well, I can understand them. But there's kinds of speech therapy. Can you kind of go over the definitions and the different kinds that a parent might see that their child is having?
So I can start off by saying that we work in a variety of settings. So we could be in a hospital, outpatient center, we could be in the schools, we can do home health. But particularly for schools, not only would it be like an articulation issue or a speech issue, it could be a language issue. It could be, again, I'm talking to them, they can't follow a 1- and 2-step direction. Go get your sock, put it on your foot. They're not giving me eye contact. They're not playing with their peers. So we also look at like what we call pragmatics or social language. They're playing by themselves. They're not engaging or interacting with someone else. I'm trying to think of what else. So went over language, speech. Oh, fluency, which is really important, like stuttering. We focus on that. When are they having hesitations or blocks? When we say hesitations, when they're talking and then they stop. And then it's like they constantly repeat that sound like, trying to get it out. Or a block is when they're talking and then they just kind of get caught in their breath. They just stop talking. That's like a fluency concern. So anything that we will be looking at would, impact them educationally within the classroom. If the teachers are, trying to tell them to go and get their book bag or copy this from the board onto their paper, that's like it could be a language processing thing. So we're looking at not just the speech or articulation. We are looking at reading comprehension. We're looking at phonics. Can they match the sound to whatever they're hearing to the sound that's on the letter that's on paper? So we're looking at that as well. So I'm glad that you asked that, because I do have to talk to a lot of parents. They're like, "Oh, my child can speak well." I'm like, "Yeah, but we're also looking at this as well." So, and that's okay. That's a common mistake.
Yeah, exactly. So, there's like you said, the articulation and the fluency in what you're hearing, but then there's things like expressive, is a child able to express themselves clearly? And I remember one of my children used to always kind of mix up pronouns and mix up,
right.
Almost seemed like really bad grammar, but it was like kind of putting, now I can't think of an example, but kind of putting like words in the wrong place in the sentence. Another common one that I remember my children had is that they could receptively kind of respond to a question, but it was hard to initiate or go back and forth in a conversation more than one or two times. So it's important to know that there's lots of different kinds of places where a speech therapist could work with their student or their child.
Right. And I'm glad you brought that up. We do work on just basic language concepts. Are they using pronouns, correct gender, verb agreement, plurals? And I'm working with a kid now with plurals versus singular. So we have to go down and break down these basic language concepts to improve their grammar, in written. I won't say we do the written expression part, because that's more of the special ed teacher or the teacher that touches on that. But we all work together to improve the child's overall language. And then what's really important to me is, can a child advocate for themselves? Like when they have to go to the bathroom, can you say, "I need to go to the bathroom"? Or specifically when children who have severe autism, we've had children that cannot tell us when they want to go to when they are not feeling well, they have a headache, so they have behaviors. So we try to come up with a plan to improve what we call functional communication, just to be able to advocate, to be able to speak up for yourself, to say, "I don't feel good right now." I had a kid the other day tell me, "I just don't feel like it today. My stomach is hurt." I said, "You know what? I'm glad you're able to tell me, and you didn't exhibit a negative behavior. You were able to tell me, speak up, and say how you were feeling. And, we were able to have a conversation about it, and we moved on." So we do work on, because a lot of times the behaviors are because they can't communicate. So we try to exchange the behaviors for a functional communication skill, or just what we say a communication skill, to be able to just say basic things, to say how they're feeling or say what they need.
Right. And so being able to express their wants and needs. And I thought that because we're recording, I want to reemphasize that lots of times when we see students having behavior issues, it does stem from an inability to communicate or frustration around communication and language, especially with our younger students. And sometimes those are mislabeled as, problem children or troublemakers or things, but it's really their way of saying, "I've got a problem." And lots of times it is language, speech-based.
Right.
So let's say a parent, you all have done evaluations and your school meeting, and you've had an IEP, and we'll be having a different, special ed webinar on IEPs. But let's say your child gets recommended for speech therapy in a school. what does it look like in the day? Like just kind of the logistics of it. And let's say you've got a third grader who's going to now get 30 minutes of speech a week. What might that look like?
You said a third grader?
Yeah, or a grade,
Okay.
a student in grade school. So not a high school student.
Right. So, of course, it depends on what the treatment plan is and what their deficits are. So, if it's let's just say third grader who has like reading issues, a lot of times, we're trying to move to the push-in model where the services are delivered on the inside of the classroom. However, that may not be possible. So we may pull their kid out. We try to inform the student, ahead of time, like, hey, I'm pulling you out. We're going to do this. And I may have them with a peer. So what I try to do is pair them with someone who has equal deficit or equal things that we need to work on. And so I pull them out. We come to my therapy room. And what I try to do is just have a kind of a schedule, like a visual schedule, like, okay, first we're going to do this. Then we do this, like a follow-up activity. And then they may get free time, like maybe 2 or 3 minutes. Then we have to go back to class. So for that type of student, yes, like pulling out one time a week. If I can go in, I would try to work with the teacher and provide like some strategies for the teacher and sit next to the student, but not only just be working with the student. I'll be working with, like say if he's at a table with 3 other kids, we'll all work together just so he won't be singled out, because as they're getting older, kids are now being self-conscious about who's coming in. I'm sorry, there's some noise outside of my room. Let's see if I can still. I'm sorry about that.
And that's a typical moment in a day of a school speech.
Yeah. Okay, so typically, students are starting to become self-conscious, and they're like, why are you pulling me out? And why are you working with me? So now I make it look like I'm not just working with you, I'm working with all of your peers. So we're all going to work together because, again, it's a social issue at this point, especially in middle school, especially, 4th and 5th graders are starting to feel that way. So now we have to mask it, and I may bring a peer that has services as well. And we will work together, and most of the time I have no problems bringing them with me. So sometimes I do go into the classroom and do group sessions if they have like severe autism or if they're in an inclusion classroom, because of course doing one-on-one with a child with autism kind of defeats the purpose because they have a social skill issue. So if you're pulling them out one-on-one, we kind of want to pull them with another student to improve their social interaction. So I typically go in a classroom and I would collaborate with the occupational therapist here. So we come up with a schedule and we do some activities together for about 45 minutes to an hour. And then we do a follow-up activity, and then we check in with the teacher. And then, I think that's about it. And then we kind of try to check in with the parents, just let them know what we're working on, send some things home like, hey, this is what we did. Go home and bake a cake with them, or, that could be following directions or sequencing or things like that.
Yeah. And so I think it's a great point here that, if a student needs any kind of special education services, and especially specifically speech therapy, they're part of you're part of a big team. You work with the teachers. You're not just working solo with the students and in a bubble and no one else is working, but you're in the classroom and you're helping the teachers and they're telling you what they see, and you're working maybe with other, we haven't talked about occupational therapy, but there's other types of therapy, therapists that are going on in schools. So it's a real space because you're not just doing that speech, but you may be doing social, or you may be helping with, a homework assignment or something like that, right?
Exactly. So last year I was working with the physical therapist because it comes all the way back down to basic things. So I would pull the student out and try to take them upstairs, and the student could walk upstairs. So we had to go back and collaborate with the physical therapist to say, okay, what do you want me to do to get this child upstairs? From there, I built in a language. So we would go to the door. I would say, open door. And so he would have to open the door. Then we'd go up the stairs. So I'm trying to build in language even from when I pull them out of the classroom. And then a lot of times we talk to each other like, did they have a good day? This is what we're working on. Try to reinforce this in your session. And then we build in, we try to, because language encompasses everything. So we try to collaborate and build in whatever we can, let's see, about, with each related services. So with occupational therapy, like we're working on writing. So I'm writing, having them write down the answers to a question. So it just depends on what they're working on. But yes, we typically try to talk to each other, try to keep everything consistent, collaborate with the teacher, because that way, again, they're getting more services, not just from me, but from the PT, the OT, the special ed teachers. So we just try to keep everything consistent to improve and, to promote independence.
Mm-hmm, mm-hmm. And the goal is, the goal is definitely that a student that would have, maybe just specifically speech therapy wouldn't always need speech therapy in school. They may, the term's appropriate to say, but graduate from work with you if you achieve those goals. It can be a short term, maybe a year, maybe 2 years, and not their whole school career, right?
Right, and of course it depends because DC, DC has their own policies that we have to abide by. So most of the time, if we test a child in, it depends on, what we're working on. If I'm saying that they're making a lot of progress and they just need a little bit of push, then I would keep them for about a year, hold them on consult to make sure they maintain their skills, and then after to determine if they maintain their skills, then I would try to test them out.
Terrific. So you want to make sure they're maintaining what they've learned. So
right.
Getting close to, I always promise everybody we'll be done at 1 so that we keep these to 30 minutes. But I'd love to know, been working with parents in schools for so long, what would you love parents or would like for parents to know about speech therapy or the process that if you could tell us a couple of things, what would it be?
You sent that question to me, and I've been thinking for the past couple of days, like, what is it exactly that I need to tell parents? But I think the main thing is don't wait. If you have an issue, if there's some kind of concern, and there are, therapists out there that are here to help you, to empower you, to educate you, to just say, okay, it's okay. I've had parents to say there's a list. I'm like, all right, here you go. Let me give you some strategies. But we're here to support you and empower you and give you this knowledge about how to work with your child at home. Let's see, one thing I do want parents to know is that we're not just always playing with your child, because I've heard parents say that, like, I take them to the therapist, they're just playing. But no, like, we have we could be doing play-based therapy, or we could be masking the therapy to look like we're playing with the child is actually working.
Right.
So we do have strategies that we implement so the child can come to us, because communication is important. And if we don't have a good relationship with them, then they're not going to come. So we have to try to build the rapport and, again, mask it so they know, so they won't necessarily know they're doing work until they get older. Then it's like, well, you have to do this work. It's not going to be easy, but you will be successful. And then, again, we just want, I think, as a speech therapist, I've always just wanted my students and my patients to be successful and independent and advocate for themselves. So go ahead.
So I was just going to say, I didn't mean to interrupt, but you've certainly hit on two themes that is part of the goal of the Special Education Thursdays and our work with parents is the better advocates that parents are, the better advocates their children will be. And that's really when we have students in special ed. And then secondly, that special education can be a really good thing. It shouldn't be scary. It shouldn't be, something you don't want, because it's really individualized and positive, and it's student where they need to be. So part of this process of these kinds of information pieces that we're doing is to kind of take some of the stigma and the uncertainty from it. And speech therapy, like you said, is, can get, told it's play, but, we all know that children learn best when they play, and best through play.
Exactly. And you brought up a good point when you said speech and language it's not going to stick around for life unless it's a severe deficit. So most of the time, if you get the student or child in early, what we call early intervention, They may just need it for a year, and that's it. It's not something that they're going to be marked with for their entire lives, and it's not a bad thing that they need this service. We're literally trying to get you in here, provide this service, show our parents how to do it at home, so that way they won't need us anymore. So, and that was what my dissertation was built around. I was training the siblings to do the work at home. So if they had equal age siblings or, a little bit older, I was training them to say, hey, you won't need me because I'm going to train you and your parents to work on the same things that we're working on. And that way I can discharge them from the service, but you guys are still working on it. You're still improving your language while you're helping your siblings. So, yeah, I'm glad you said that. I was just thinking that it's not something that's a negative thing. It's just we're trying to get you in and out and promote independence.
Right. No, that's been terrific. Well, thank you so much. I have been monitoring to see if we've got any questions, but it doesn't look like we have, so that might be a very good thing that we've covered a lot. I will. You said we've been recording this, and as soon as the recording's ready, we will put it out on the AJE website as well as out on social media. And Dr. Camp, thank you so much for talking with me. I hope you enjoyed it as much as I did. I learned something new every time I talk to a speech therapist or an occupational therapist. Appreciate it.
Thank you. And if they need any more information, you can always go to the American Speech and Hearing Association, or what's called ASHA.org. There's a lot of information for the public. It's listed for the public, and parents can just read information and literature about what does a speech issue look like, or what does a language issue look like. So you can always go online and just get some more information about that and when to get help for, a communication deficit.
That's great. And I believe www.asha.org.
Yes, asha.org. You're right.
Terrific. All righty. Thank you, everybody. We appreciate it. And again, thank you so much, Dr. Camp.
All right. Thank you.
Bye-bye.
Bye-bye.